The feet can reveal valuable signs about heart health, as they are the body's extremities that suffer the most when blood circulation is impaired. The blood, pumped by the heart, must overcome gravity to reach the feet, and any failure in this process can produce symptoms that go unnoticed in daily life. This intimate connection between the feet and the heart means that subtle changes, such as swelling, pain, or altered coloration, serve as a true alert for cardiovascular issues. When the heart cannot pump blood with sufficient force, the body tries to compensate, but the extremities are the first to feel the effects. Slower circulation can cause a sensation of heaviness, cold feet, and even unexplained fatigue. These signs, often attributed merely to age, may indicate that the cardiovascular system is overburdened or weakened. Therefore, observing what happens to the feet is a simple yet powerful way to monitor heart health. Another important aspect is that the blood vessels in the legs and feet are more susceptible to the buildup of fatty plaques, which can reduce blood flow and increase the risk of arterial diseases. When this occurs, the body loses the ability to nourish tissues properly, resulting in symptoms like numbness, cramps, and changes in skin color. These small details, when noticed in time, help physicians identify cardiac problems before they become serious. Thus, maintaining constant attention to the feet is not just a matter of aesthetics or comfort, but an essential preventive attitude. They function as a silent thermometer of the heart's and circulation's performance. Recognizing this connection allows for early action, seeking medical help, and adopting habits that protect both the heart and the body's overall well-being. Swelling in the feet and ankles, known as edema, is one of the most visible signs that something may be amiss with the heart. When blood pumping weakens, fluid tends to accumulate in the lower parts of the body. This happens more frequently at the end of the day, especially in people who spend a lot of time standing or sitting. Although it may seem simple, this symptom can indicate heart failure. Before continuing, how about supporting the channel and joining our community? By becoming a member, you help sustain this work and gain access to exclusive videos and content. Just click the button next to subscribe and join the health team. In older adults, edema can emerge slowly and be mistaken for fatigue or common age-related fluid retention. However, if the swelling persists even after rest, it is important to investigate. The accumulated fluid in the legs shows that the heart may be struggling to circulate blood back to the rest of the body. This buildup overloads the system and, if untreated, can lead to serious complications. In addition to visible swelling, other signs may accompany the issue, such as a sensation of heaviness in the legs, tight-fitting shoes, and shinier or stretched skin. Sometimes, the edema is more intense on one side of the body, which may indicate local vein obstructions. In any case, it is an alert that should not be ignored. Observing if the swelling worsens throughout the day is an important clue to report to the doctor. To alleviate discomfort, some simple measures can help, such as elevating the legs, reducing salt intake, and staying active. However, when the swelling is frequent, painful, or accompanied by shortness of breath, it is essential to seek a healthcare professional. Appropriate treatment can protect the heart, improve circulation, and prevent the issue from evolving into something more severe. Changes in the color or temperature of the feet are clear signs that something may be interfering with circulation. Feet that become cold, purplish, or pale indicate that blood is not reaching the extremities adequately. This occurs when the heart or arteries have difficulty sending oxygen and nutrients to the tissues. These signs should be observed carefully, especially in older adults, as they can reveal cardiovascular problems in their early stages. When blood flow is reduced, the body prioritizes vital organs like the brain and heart, leaving the extremities with less irrigation. As a result, the feet lose warmth and change coloration. This alteration is more noticeable in cold environments or after long periods of sitting. Sometimes, the toes may turn bluish, indicating local oxygen deficiency, a symptom that requires immediate medical evaluation. In addition to color, temperature is also a gauge of circulatory health. Feet that are constantly cold, even on warm days, may indicate heart failure or peripheral artery disease. Conversely, very hot and reddish feet may suggest inflammation or fluid buildup. Observing these variations helps the doctor determine if the issue originates from the heart, veins, or arteries. To care for circulation, it is important to maintain habits that promote good blood flow, such as engaging in light walks, avoiding tight clothing, and not crossing the legs for extended periods. It is also essential to keep the feet hydrated and protected from the cold, as the sensitive skin of older adults can suffer from minor injuries. Caring for the color and temperature of the feet is, in fact, caring for heart health. Wounds on the feet that take a long time to heal are an important sign that something may be wrong with circulation. When the heart or arteries cannot deliver sufficient blood to the extremities, the tissues receive less oxygen and nutrients, hindering the natural healing process. This causes small injuries, blisters, or simple cuts to turn into persistent wounds. In older adults, this situation requires immediate attention, as it may indicate evolving cardiac or vascular diseases. Often, these wounds appear discreetly and are mistaken for injuries caused by tight shoes or minor falls. However, if the injury does not heal after a few days, there is a risk of infection and worsening of the condition. Poor circulation prevents the body's defenses from reaching the wounded area, favoring bacterial buildup and further delaying healing. This is an alert sign that should prompt older adults to seek medical evaluation as soon as possible. In addition to the difficulty in healing, other signs may accompany the issue, such as local pain, thin and shiny skin, or darker coloration around the wound. In some cases, the problem may be related to diabetes, but it can also be a consequence of heart failure or arterial obstruction. Identifying the cause is essential to avoid complications and start the correct treatment. Caring well for the feet, keeping them clean, dry, and protected is an important preventive measure. Whenever there is any wound, the ideal is to avoid home remedies and seek professional guidance. A simple cut that does not heal may be the first sign that the heart and circulation need attention. Detecting it early is the best way to protect health and avoid greater risks. The sensation of numbness or tingling in the feet is more than a passing discomfort. It can be a warning of poor circulation. When blood does not flow strongly enough to the extremities, the nerves receive less oxygen and begin to lose sensitivity. This symptom, common in older adults, usually appears first in the toes and can gradually spread throughout the feet. Many people associate tingling with posture or tight footwear, but when it is frequent or constant, the heart may be involved. Weakened circulation reduces nutrient transport, compromising nerve and muscle function. This sign, if ignored, can evolve into total numbness and even loss of balance. It is also important to observe if the tingling is accompanied by cold feet, color changes, or mild pain. These symptoms together suggest that the cardiovascular system is overburdened. The body sends subtle alerts before the problem worsens, and this is one of them. To alleviate discomfort and protect circulation, it is advisable to move frequently, perform light stretches, and maintain habits that stimulate blood flow. If the tingling persists, the ideal is to consult a doctor to investigate the cause. Treating the root of the problem helps preserve not only foot sensitivity, but also heart health. Feeling pain or cramps in the feet and legs while walking may seem like just a sign of fatigue, but it is one of the main symptoms of poor circulation. When the heart or arteries cannot send sufficient blood during physical effort, the muscles lack oxygen and begin to hurt. This pain usually appears after a few minutes of walking and improves with rest, distinguishing it from common muscle aches. In older adults, this discomfort may indicate a condition called peripheral artery disease, which is directly linked to cardiovascular issues. It occurs when there is a buildup of fat in the arteries, hindering blood flow. Over time, inadequate circulation can cause leg weakness, a sensation of heaviness, and even wounds that do not heal. Therefore, it is a symptom that should not be ignored. In addition to pain, frequent cramps at night or when climbing stairs can also be warning signs. These episodes show that the body is demanding more oxygen than the blood can deliver. The symptom tends to worsen on cold days when vessels contract and blood flow slows even further. Maintaining an active routine, with light walks and daily stretches, helps improve circulation and strengthen the cardiovascular system. It is also important to avoid smoking and control cholesterol, as these factors worsen tissue irrigation. If the pains persist, medical follow-up is essential to prevent major complications and protect the heart. Many older adults tend to ignore signs in the feet, believing they are just natural consequences of age. However, symptoms like swelling, pain, numbness, color changes, or wounds that do not heal should always raise an alert. The body usually sends small warnings before the problem becomes severe, and the heart is one of the organs that benefits most when these signs are recognized in time. Seeking a doctor soon after noticing these changes is essential to avoid complications. A cardiologist or vascular specialist can investigate if there is heart failure, poor circulation, or peripheral artery disease. Simple exams, such as vascular ultrasound and electrocardiogram, help identify if the issue is related to the heart or blood vessels. It is also important to observe the frequency and evolution of the symptoms. If swelling increases, pains worsen, or the feet change appearance in a few days, this indicates the body is out of balance. The earlier the diagnosis is made, the greater the chances of controlling the problem with medications and lifestyle changes. Maintaining regular medical follow-up is an attitude that saves lives. Even if the symptoms disappear, the ideal is to perform periodic checkups and discuss any noticed changes. Caring for foot health is, in fact, caring for heart health, and recognizing the right moment to seek help is the first step to ensuring quality of life and longevity. Caring for circulation and the heart begins with simple attitudes that can be incorporated into daily life. Maintaining a routine of light walks, moving the legs during rest, and avoiding long periods of sitting are measures that stimulate blood flow and prevent foot swelling. Moderate physical exercise improves heart function, strengthens muscles, and helps control blood pressure. Nutrition also plays a fundamental role in cardiovascular health. Reducing intake of salt, saturated fats, and ultra-processed foods decreases fluid retention and protects the arteries. Prioritizing fruits, vegetables, legumes, and sources of good fats, such as olive oil and fish, helps keep blood flowing more smoothly. Drinking plenty of water is another essential habit to avoid dryness and improve circulation. Quitting smoking is one of the most important steps to preserve the heart and vessels. Tobacco compromises oxygenation, causes artery hardening, and increases the risk of thrombosis and heart attacks. Additionally, controlling diseases like diabetes, hypertension, and high cholesterol is indispensable to avoid foot damage and cardiac complications. Finally, observing the feet daily is a form of care that can save lives. Check for swelling, wounds, spots, or changes in color and temperature. Any alteration should be reported to the doctor. Caring for the feet is a practical and efficient way to monitor heart health, a reminder that small daily habits can ensure healthier aging with greater quality of life.